I have severe pain. I cannot do anything. I'm very sensitive to cold. Slightest cold draft aggravates. Whenever I get cold or there's a change of temperature, I'm the worst. What is the effect? She says right side of the head pains, maxillary area around the eyes, the temple, everything is severely painful. And I said, describe this a little bit more. And she says that it starts with sneezing, followed by cold, nasal block, and head pain. Now, my friend, this is very important thing I want to share here is I spoke a little bit about process. Here also it's very important to understand what is the process, disease process, right? How does it start? So every process is different, right? Sometimes a patient can say, doctor, 4 days ago, you know what happened? I was out in the sun, there was a mild uneasiness, I was feeling weak, I came back home. That night I had a mild headache. The next day I was feeling very weak and there was a backache. And a day before yesterday there was headache and myalgia and body pain. And yesterday I started with fever. And today I have around 101 fever. This is one expression a patient will express. The other patient may say, doctor, yesterday I was not feeling good. I had gone out. I did not sleep properly. In the morning, as I woke, I had 102 fever temperature. This is one expression. Third patient can say, doctor, I was completely fine at 12 o'clock, and within 2 hours, I checked, I had headache, severe body pain, and temperature rose to 102. Now, what does this define, right? It defines the pace of disease. It defines the process, that what is the pace the disease has taken, right? So it's very important when you are taking a case history, you should also take into the inquiry what sort of disease is progressing and how it is progressing. This is first. Second, what are the symptoms which are coming on in the path? This is also very important. I'll come to this part again. So the first patient, you can refer it as slow insidious process, right? So you can go back into rubric and say generalized symptoms appearing gradually, right? The second patient, you can see immediately sudden, right? There is sudden manifestation of complaint. So these are two different aspects. So it defines, so your remedy will also change, right? You will need a remedy which is slow in its nature. You will need a remedy which is fast in its nature. That is the pace, right? So process is very important. So what is the pace of this is the first part. Second, what are the symptoms which are associated with the pace will also define the remedy, right? So for example, in here, the patient says, I started with sneezing, then cold, nasal block, and headache, right? So now when you look at this is one expression. The other patient can express as, doctor, you know what? Uh, I'm having running nose. Please give me some medicine. I know after 4 days I'll have asthma. I said, why are you saying like this? No, no, doctor. Whenever I start sneezing and have throat irritation and nose irritation, I'm bound that after 4 5 days I'll start getting bronchitis. Why? Because next day I start with throat irritation and then it goes to little coughing and then complete bout of breathlessness. This I know, this is my pattern. So this pattern defines the symptom progress, right? So what is the difference between the two, which I said? What is the process? The one process is going upwards, right? Ascending. The other is going downwards. It is descending. So the when you can open the repertory and you can see in generalities or in Fatak, you can see symptoms like upwards and downwards. So my friends, lot of things depends upon what you are looking in the case, how the disease is coming and unfolding in front of you. Is it fast, is it slow, what symptoms are coming up, what is the process coming up, what is the sequence of symptoms coming up. It's such a beauty that each remedy expresses in a different form, right, unfolding in front of you, right? And in on this basis you can go and refer, check the repertory or materia medica and find out a group of remedies or remedies. So in this case, coming back to this case, the patient says that it starts by sneezing, then nose block, and then the headache. So it is a process which is going upwards, right? This we keep in mind, that's all. What are the modalities? Worse with odor, cold, air, noise, movement, light, and cold drinks, right? And better by warm and heat, right? Then she tells about her little bit about her state of mind. She says, I'm always in hurry, always running, always. There's so much work which is there in front of me. I have to constantly keep doing things. Slightest movement increases my pain. spasms is there, and she describes the contraction of hands. This is the pain which is there. She says also that she has observed her pain worse when she is stressed. So here also finds another aspect. Apart from modality, she is worse with stressful situations. She describes her head feels shaking from inside. The brain is shaking from inside. This is the way she describes it. So what does she do during the time of pain? What she wants to do in this pain? So some time back I told you what postures are important, right? What person takes during the disease state, right? So many times some patient says, doctor, when I have headache now, I just go inside my room and I just want to close all the curtains, be quiet, and no one should come and disturb me. If anyone comes and disturbs me, I get so much irritated. I just say, don't come, right? I don't want light, noise, nothing, just wants to be quiet. This is the posture someone takes, right? So you can get the rubric: disturbed, aversion to quiet, wants to be repose and tranquility, desire for worse from noise, worse from light, and probably you get a remedy which is Naxomita or Bryonia. Both are very close. Are you able to understand? This is the posture someone takes, right? So always ask, what do you do when you are sick? What you want to do when you are sick, right? What is the thing that will help you? So that will give you an idea what is the person doing, right? So here I ask, when you have severe headache, what do you want to do, right? She says, I just close out from everything. I shut myself, and so I get more focus. I said, what do you mean by this, right? So you have here the elements are hands, head, hold, and close. You can refer the rubrics which are in the rubric in the repertory. So at this point, she bends her head in front. This is the picture of the patient. She just in front of me. She sits here. She puts her hand like this. Doctor, this is the posture I take when I have severe headache. I just go in my room, sit, and I'm just like this. I my elbows on the knees. I just want to be quiet. This is the way I feel when I have a headache. I feel better. So this was characteristic, right? The posture during her disease condition, right? So we move forward with this, right? So when you look at this, interestingly, when you look at, you have symptoms are, when you convert the symptoms, you have head pain, side right, sensitive to cold, sinus affection, generality is cold aggravation, taking cold becoming aggravation, head, holding head with hands amelioration, face pain